Thank you for joining us. I'm Richard Peritz on location at the Rosen Hotel in Orlando, Florida. Our guest today again is described as one of the most outstanding and dedicated community and business leaders in the United States. He is an inspiration right here in the United States, in fact, and worldwide, from Israel to Haiti and Ecuador, China and other countries, not only with his Rosen Center hotels and other properties, but in other endeavors as well. Our guest, Mr. Harris Rosen, will tell us about his outstanding achievements in business and also about the indisputable, proven, successful 25-year track record of his healthcare program, Rosen Care, right after these messages. With us now is Mr. Harris Rosen. It's a pleasure to have you back on the show, sir.
Thank you, Richard. Appreciate it.
I have so many questions I'd like to ask you, and of course, the first would be, I'd like to ask you to update us on your wonderful hotel chain. What's new?
Well, there's always something new going on at Rosen Hotels. In the last 3 years, Richard, we've been very busy. The economy has not been terrific. And so I decided that when we're struggling a bit, it's a wonderful time to spend money on our hotels, serious money. So how much have we spent in the last 3 years? Close to $115 million.
Oh my God.
Doing what? Refurbishing from top to bottom. And it's really been quite extraordinary. All of our hotels have been completely redone in those 3 years. I have kept 335 people working during these very difficult times, and I refer to that program as the Rosen Stimulus Package. It's just real shovel-ready work, keeping people working, doing productive things, making sure that Rosen Hotels and Resorts maintains that first-class quality. That's what we've been doing. Busy, busy, busy.
Refurbishing your hotels during difficult economic times is a very interesting venture, most commendable. I've noticed that in this wonderful magazine right here, there are all sorts of things you've been involved in the last year since I last had the opportunity of interviewing you. Many things have changed. Tell us more about your chain.
Yes, we are always involved in interesting things. You know, of course, that we've adopted a neighborhood here in Central Florida, and we adopted that neighborhood about 20 years ago. And we provide every youngster in that neighborhood, 2, 3, and 4 years old, with a free preschool education. In addition to that, every youngster born in that neighborhood gets a free college education. So they start at 2, they complete kindergarten, elementary school, middle school, and high school. 100% of my kids from this neighborhood, this is a disadvantaged neighborhood, graduate from high school. 100% in the last 8 years. 100%. 77% of those youngsters go on and go to college and graduate from college, and the Rosen Foundation pays for everything. In addition to that, we built a Jewish community center, which now is ranked #1 in terms of preschool and elementary school education. In addition to that, we're starting a huge project in Haiti, a village in Haiti, and we refer to it as La Petite Maison de Haiti Village Kibbutz. Why? Because we're building a village, and in addition to the village, we have an agricultural component, so the people who live there can work there and be self-sufficient. In addition to that, we built the Rosen College. Started with about 100 students. Today we have 3,500, the fastest growing college in the United States of America.
Incredible.
Well, when you say busy, yes, I keep busy. I have 4 children, 23, 22, 21, and 19. I have a job, but I do all of these other things. So my life is full and busy.
And you are so productive, and you contribute to your environment, you contribute to Central Florida and way beyond the United States. Good Lord, if everyone was as idealistic as you, we'd live in my opinion, in such a far more inspiring world.
Well, I appreciate the comment, and I do agree with something you said. If indeed every neighborhood in the United States of America that was underserved, If they had a program like ours, making sure that every 2, 3, and 4-year-old had that wonderful preschool education, making sure that every youngster who graduated from high school and was accepted to college, everything was paid for, could you imagine the changes in our society? Crime in this neighborhood, in Tangelo Park, is down 55%. Do you know that if every neighborhood had this program, we would look around and we wouldn't recognize ourselves? We wouldn't. We wouldn't. Crime is down. Youngsters that never would graduate from high school are not only graduating from high school, but they're going on and graduating from college. Why can't we do it? And the government, we don't ask them for a penny. It's all done through the Rosen Foundation, but there are so many foundations in the United States. We happen to be the most philanthropic nation in the world. Why can't we find people like Gates or Buffett or Jobs to adopt a little neighborhood and do what I'm doing and change our society? That's my dream.
Very powerful question.
That's my dream.
And of course, they should.
They have to hear about the program first, and maybe they'll hear it on one of your beautiful videos.
Well, thank you, sir. Strange times we are living in, and so much change occurring in the world. And speaking of change, there's also a topical matter of great interest today, and that is that of healthcare.
Yes, sir.
What are your thoughts with regard to healthcare?
That's a very interesting question. Let me share with you. About 25 years ago, I became so disenchanted with the healthcare system in the United States, particularly as it related to people who work in our organization, that I said we have to change the paradigm. It's not working. The insurance companies that I work with don't really care about the well-being of my associates. I'm not suggesting they're evil or they're bad people, but they don't really care about our people. I care about them. I want everyone who works for me to be healthy. I want their wives or their husbands or their children to be healthy. How can I make that happen? And a little voice said to me, you have to get into business yourself. But I don't know anything about the business. And the little voice said, you can learn. So what did we do? We created our own little clinic. We started with one doctor, one primary care doctor, a nurse practitioner, and an administrator. And our associates went there for their primary care health. And they received wonderful care. And my cost per individual dropped, this is 25 years ago, from $2,400 per person to $748 a person. Why? Because they came to this little clinic and we provided wonderful care. And we nipped in the bud those things that could have one day become serious problems. If their cholesterol was a little bit high, we jumped right on it. If it looked like their sugar levels were a little high, we jumped right on top of that. If they were a little bit overweight, we put them on a beautiful program. And this program expanded as our company grew from 700 employees to nearly 4,000 employees. And today, our medical center has 5 full-time doctors and a staff of 38, a nutritionist, a podiatrist, a chiropractor, a full fitness center. We do radiology, we do mammograms, we have a pharmacy, because we love our associates, we want to keep them healthy, and we take good care of them. Here's an interesting fact. The cost per individual for health care in the United States of America is about $8,500. What does it cost Rosen? A little over $3,000. I have saved, compared to the national average, over the past 20 years in my little company, over $220 million by taking care of my associates in my facility as opposed to doing it in the traditional way. We love our associates, we take good care of them, and the results are clear and evident. And we believe that others can replicate what we're doing.
Well, that is incredible and outstanding. In fact, it should be made public knowledge nationwide. People should emulate your model.
And that's why I'm talking to you, so you can help me spread the gospel. Because listen to this, 2 congressmen visited our company. They said, "We heard about what you're doing, Rosen. It sounds strange. Does it work?" "Sure." And they spent a day with me. One of them was a Representative Pallone from New Jersey. The other was Representative Grayson from Central Florida. And they brought a cadre of numbers crunchers with them. And at the end of the day, they sat down with me and they said, "This is amazing. Do you know, Harris, that if every company replicated your program and the results were comparable to yours, the United States of America would save over $1 trillion a year." So what has evolved is something people refer to now as Rosen Care. What is Rosen Care? Rosen Care is this. Number 1, everyone who works must have health care. Yes, it's a given. It is something that in the United States of America, we should provide to all of the people who work. Yes, I believe in that, and I trust that that is something that in my lifetime I will see. Now, legitimately, companies will say, "We can't afford it. We can't afford even $4,000 we can't afford." So here's part of Rosen Care. Rosen Care says to every company that is providing insurance, and every company will be mandated to do that, we will give you, the government will give you a tax credit for every dollar you spend on health care up to a certain amount. So if you're spending $4,500 and we give you a tax credit for $4,500, it's a wash. And companies I have spoken to about this have said, "Harris, if you do that, we'll jump on board in a second." So which is better? For the government to create a program with all of the difficulties that they're encountering, or for people to jump on board Rosen Care and say, "Let's keep it simple. Let's keep it simple. Everybody who employs one person, 1,000 people, 10,000 people, 100,000 people, they must provide health care." And the government will give them tax credits. That will take care of 250 million people who work without the government getting involved at all. Somebody might say, "Well, what about people who aren't working?" I say if they qualify for Medicare, they get it. If they qualify for Medicaid, they get it. What about those people who don't? That's a fair question. And there should be about 10 to 15 million people who fall into that little crack. Here in Central Florida, we have the answer. 2 organizations, one called Pecan, one called Shepherd's Hope, provide wonderful services, primary care, specialty care, hospital care to those individuals who are not working and don't qualify for Medicare or Medicaid. How do they do it? This is amazing. They ask for volunteers. There are so many retirees here in the state of Florida that you send a little notice out, you say, "I'm looking for a primary care doctor to work 1 day a week. Do I have any volunteers?" Thousands of volunteers. And so you create a beautiful little clinic with all of these volunteers, and now you take care of those people until they can find a job with health insurance. You've got volunteers, but what about the hospital component? Here's what's happened. The hospitals say, "We love Shepherd's Hope and Pecan." Why? Because as long as they're there, it will keep people out of the emergency room. And we, the hospitals, don't want people rushing to our emergency room for a broken finger or for an infection. So we love what you guys are doing, and what we will do, because we're so appreciative, is that we will provide you with several beds to take care of those people who are in your organization who need hospital care, and we won't charge you a penny for it. Now, every state in the union could do exactly what I've just said. They could have Rosen Care, they could have Medicare and Medicaid, and then they can have Shepherd's Hope or Pecan to take care of those people who don't work and don't have Medicare or Medicaid. You see, it's not rocket science, it works. And I'm trying to spread the gospel. And we've been doing it for 25 years.
Incredible. And when you bring this to the attention of people in Washington, what occurs?
Do you understand the word garnished?
I do.
I have recently been on Fox News. They came to Orlando and videotaped me in our medical center. They spent almost a full day. Greta Van Susteren show. And then they called and they said, Harris, we've got about 10 minutes, which is a long time on television, and we think it's fantastic. And so I said, when will it be on? And they told me, and I watched it, and it was really very good. It wasn't 10 minutes, it was about 6 minutes, but I'm told that that's a long time. And we started getting emails and phone calls from people who said, does it really work? Is it really possible? Can we replicate it? And that happened about 2 weeks ago. So we're still waiting to hear from some of our officials in Washington, D.C., because I believe that if the Republicans are saying we don't like Obamacare, we don't think it will work, and so far they would be proven correct. If they say that, I understand that. I understand that. But there must be an alternative to Obamacare. You can't just say, I don't like it. You have to say, I don't like it because, and I'm capable of providing an alternative to it. And Rosen Care would be a great alternative. Unfortunately, the people we have sent it to in Washington, D.C. have not yet responded.
And you have a 25-year track record of success.
Richard, that's correct.
Incredible.
It's frustrating.
What's even more frustrating to me is, in this beautiful world in which we live, there are so many challenges and problems, but mankind, humanity has solutions which can be implemented, whether it's environmental, educational, or in healthcare. And what is very disturbing is that intelligent solutions are often not implemented.
Isn't that so sad? And so what's the answer? Why can't I get another Tangelo Park program done? Why can't I get anyone to listen to my health care program? I don't know. I don't give up easily, but I don't understand. It is something that I've asked myself. And perhaps after 25 years we have a wonderful track record, and perhaps we've just not gotten word out. Perhaps people haven't heard of what we're doing. But I will tell you that I believe in my heart of hearts, if others jumped on the wagon for Tangelo Park and for healthcare, we would not recognize our society. That I believe in my heart of hearts.
And that's what we need, really. You see, you've proven that your method could actually save the United States $1 trillion in costs. Everyone is speaking about the deficit and so forth. It is inconceivable that the powers that be don't closely analyze and examine what you've done and achieved and proven in 25 years. That is totally inconceivable to me.
So can you help me?
I would love to. What I can do is share with people I know as you are the amazing things that you're doing here, which is what this program hopefully will achieve as well.
God bless you. I really appreciate that.
Before we end this interview, Mr. Rosen, what are your plans for the future, other than the things you're doing in Haiti and in other impoverished areas and right here in Central Florida?
I must confess that I don't enjoy public speaking at all. I don't. But I'm being asked to do it now more and more often. Possibly because word is kind of leaking into society about some of the things that we've done over the past 20 or 25 years. And I'm very proud of that. But I don't feel comfortable receiving the recognition. And what I have offered to do is to discuss my career with those who have an interest in what it is that we've achieved. And I've been doing more and more of it. And I've learned to accept congratulations. I've learned to accept kind words without feeling embarrassed. And I do believe along the way, Richard, that we have shared our Tangelo Park program and our healthcare program, our Haiti program, our Rosen College program, our Jewish Community Center program, with so many people that now positive things are being said about those things that we care so much about. And for that, I'm so proud.
And God willing, maybe finally, these intelligent solutions and alternatives will be increasingly implemented.
If we can be perceived as kind of an impetus to what you've just suggested, my life would be a wonderful life.
Well, I would like to say that what you've achieved so far is incredible and wonderful already. I'd like to ask you a little more about the Jewish Community Center and what you've done for them.
Richard, we built a beautiful, have you ever been there?
Actually not.
Okay, it is beautiful. It is absolutely magnificent. And it's about 3 or 4 years old now, and we dedicated it to my mom and dad. It's called the Jack and Lee Rosen Jewish Community Center. And we're very, very, very proud of it. Let me tell you what I do on occasion. I don't live too far from there, so I drive there in my little car, and I park, and I watch the parents driving their children to school.
Tell us of the parents and the individuals you see in this general area attending your center.
One would believe, Richard, that because it is a Jewish community center and it has a school that is a part of it, that it would cater exclusively to Jewish families. But that's not true. I see with my own eyes mommies with their burqa, taking their little child by hand, leading that little child into the school. And I say to myself, isn't that what America is all about? Isn't that what it's all about? That little child is going to learn about Rosh Hashanah, about Yom Kippur, about Hanukkah. They're going to come home with a dreidel, and mom and dad, or the religious beliefs, will listen to the child and know that that child is getting a great education and know that that child is learning about Judaism and will be quite content and happy about it.
Most commendable and very interesting. Mr. Rosen, it's been a real pleasure. Thank you so much for being with us today.
Thank you so much. My pleasure.
We have to do this again on a regular basis.
Whenever you have time.
Thank you, sir. I'll be right back. This concludes our special program for today from On Location at the Rosen Center Hotel in Orlando. I'm Richard Peritz. Thank you for being with us.